sa contraction. Muna gitawag siyang variable kay wa siya pattern, no? So, the clinical significance, this may be caused by the fetus lying on the cord, which is dangerous if it persists. It occurs usually when there is rupture of membrane. Okay, so this is how it looks like. No, murag V-shape or U-shape siya kay mubo raman ang iyahang grabe ka mubo ang nadir and then short period of time abrupt siya, no? Okay. So, the nadir occurs towards the end of the contraction as well. And the recovery pass towards the end of the contraction as well. So, muna siya ang shape sa heart rate or heart rate during a variable deceleration. So again, variable deceleration is caused by cord compression. Early deceleration is caused by head compression. Acceleration is okay, no problem. Late deceleration is caused by placental insufficiency. Okay. So what are our nursing interventions for variable deceleration? We have give or oxygenate the mother via face mask, give IV fluids, change the maternal position to take the pressure off the cord para mo improve ang circulation. And then continue monitoring with external fetal monitor. Follow hospital protocol. Usually the doctor will do amnio infusion to supplement amniotic fluid that's left. This will provide fluid barrier to prevent further cord compression. So what is usually used here is a sterile, warm 500 ml normal saline or Ringer's lactate inserted into the uterus. So, muna gamiton ha, pag amnio infusion, butangan ng fluids ang uterus. Okay, pag nag-rupture of membrane na, di ba, manggawas naman itong amniotic fluid. So, muna makalid na siya sa mga compressions. So, pag amnio infusion, butangan ng fluids, ang gamitin ng fluids, sterile, warm, 500 ml of normal saline or Ringer's lactate inserted into the uterus. So observe for the electronic fetal monitoring and observe for improved fetal heart rate pattern. Another type of deceleration is prolonged deceleration. This is greater than 2 minutes but less than 10 minutes na deceleration. For all types of deceleration, we have to perform pelvic examination to rule out any prolapse of the cord, provide maternal oxygen, change the maternal position, correct maternal hypotension, discontinue oxytocin, amnio infusion or assist the doctor during amnio infusion, scalp stimulation, and tocolytics for uterine hyperstimulation. Okay, so let us now go to the fetal heart rate pattern classification. Category 1 na fetal heart rate pattern is considered as normal. So what is the description? The tracings with all these findings present are strongly predictive of normal fetal acid-base status at the time of observation, and the fetus can be followed in a standard manner. So category 1 includes a baseline rate of 120 to 160 beats per minute. Sometimes you consider na 110, no? Below 110 is what is or what needs intervention. But Really, the baseline rate in a normal or average is 120 to 160. Alright, then we have a moderate variability, absence of late or variable deceleration, early deceleration and acceleration may or may not be present. So, mo ni siya ang standard, no? Or what you call this? Description, characteristic sa normal or category 1 na FHR. The baseline rate is from 120 to 160 beats per minute. There is moderate variability. There is no late or variable deceleration. And early decelerations and accelerations may or may not be present. Category 2 is indeterminate. The tracing is not predictive of abnormal fetal acid-base status, but evaluation and continued surveillance and re-evaluations are indicated. Okay? So, walay signs of fetal acid-base imbalance or abnormal fetal acid base, but kinahanglan i-monitor. Ano? Bradycardia with normal baseline variability may occur. Tachycardia may occur. Minimal or marked baseline variability of FHR may be present. Absence of induced accelerations after fetal stimulation. There may be periodic or episodic deceleration. And there may be variable decelerations with other characteristics such as slow return to baseline, overshoots of shoulders are seen. Category 3 is abnormal. In here, the tracing is predictive of abnormal fetal acid-base status at the time of observation. This requires prompt evaluation and management. There is absence of baseline variability with recurrent, late, or variable deceleration or bradycardia or sinusoidal fetal heart rate. So, kinahanglan gini siya i-intervene dayon ang category 3 na fetal heart rate pattern. Okay. Now, in some cases, fetal blood sampling may be done. Ano mang mukuha mga fetal blood para ma-assess ang fetal hypoxia. Para ma-assess nimo kung kulang mag-oxygen, no, ang cells of blood circulation sa bata. Now, the fetal blood sampling may be done when the cervix is dilated at around 3 to 4 centimeters. Asa gikan ni siya gikan sa fetal scalp. So you are going to clean the scalp with iodine. Okay. I-check po sa fetal blood ang pH sa blood sa bata. Kung acidic ba siya or alkaline. The normal pH of the fetal blood is 7.25. A range of 7.2 to 7.24 is pre-acidotic. If there is acidosis, it means that the child is hypoxic. The fetus is hypoxic. Mubo ang oxygen level sa iyang blood o sa iyang tissues. So, to determine sa pH sa fetus, we have to do a fetal blood sampling. Asa gikan sa fetal scalp. This is invasive, this is dangerous, but this is the means to check for the pH of the fetal blood. To determine kung kuwang ba siyang oxygen, kung kuwang siyang oxygen, that will lead to acidosis or a low pH level. Okay. So, what's the role of the coach in labor and delivery? Unsa may role ni husband during labor and delivery? So, it is for emotional support, physical support, and for bonding with the newborn as a couple. Nindot jud kaayo kung naay emotional support ang pregnant mother or ang mother na nag-deliver because that can somehow improve the psyche of the mother and promote healing as well of the mother. Alright, so let us continue with the intrapartal period. Okay, that's enough for now. We will continue with the rest of the intrapartal period next meeting.